Hi, my name is Leah Reyes, and I am an EMT student at First Response Training Group, and I'll be performing a patient assessment on the patient complaining of chest pain. So initially, I'm going to start with scene size up, scene safety, perform BSI, establish any precautions I need to prior to. In addition, I will also determine the mechanism of injury, the nature of illness, the possibility of number of patients, and I will consider any additional resources if needed. Consider ALS support if there is any life-threatening injuries, and consider C-spine. So first I would ask permission to enter the household. Hello, may I enter? My name is Leah Reyes. I am an EMT intern, and I will here to assist and help. May I enter?
Yes.
Okay, thank you. So I've asked permission, so I'm going to continue on. I would initially start with a primary assessment. Obtain a general impression, assess the level of consciousness, is she alert oriented, and assess any life-threatening injuries and perform a rapid exam. Hi, so again, my name is Leah. I am an EMT intern, and I would ask if I could have your permission to assess and treat if needed.
Yes, ma'am.
Okay, thank you. I appreciate that. Can you tell me your name?
Maria Smith,
And what is your birthday?
5/10/54.
And where are you right now?
I am in my house.
Okay, and can you tell me a little bit about what happened?
I was just sitting on my couch watching TV and I started having some sharp chest pain on the left side.
Okay, so she's alert oriented, ×4. Level of consciousness is aware. According to the APU scale, she's very alert. Right now, I can also assess the ABCs. So airways pain, she's speaking clearly, and I will just kind of perform a quick decap BTLS on her, rapid, maybe 60 to 90 seconds or so. So I'm just going to continue on. So at this point, she's complaining of chest pain. I could also apply some oxygen while I continue to ask any questions if needed. So I'll initiate at 2 liters, but that actually put on. All right, Miss Mary. May I call you Miss Mary, or would you prefer Miss Smith?
Miss Mary is fine.
Okay, Miss Mary, I'm gonna put in some oxygen. Just gonna go into your nose, just a little oxygen support.
Thank you.
Okay, so I would her airways pain, so I'm just gonna go ahead and just kind of take a quick look at you, just to see if there's anything I need to intervene right away. Okay, so I'm gonna go ahead and touch you. So I'm just looking behind, front. So looking in her eyes, assess her pupils. I would take her glasses out, but for comfort, I'll just leave it on right now so she can see. Pupils reactive. Can you open your mouth? Say ah. Suck at your tongue. Perfect. And look and notate any drainage behind the ears. No bruising, no swelling. So I'm just gonna palpate lightly here. Zygomatic, maxilla, and mandible, and I don't find any crepitus behind the neck or around the skin. Trachea's midline, I don't see any JVD. And her breathing, she is breathing normal, spontaneous respirations, no signs of respiratory distress. So I'm gonna go ahead and take a quick listen. All right, I'm gonna just apply my stethoscope on you, take a quick listen to you, okay? Just breathe normal, take a deep breath in. So I'm gonna go in a zigzag fashion and listen to the midclavicular and then the mid-axillary going down. And if you can lean forward, utilize the same too, zigzag fashion, down the sides, okay? And can you take a deep breath for me? Perfect, okay. Lean back for me, Miss Smith, Miss Mary. So right now her lung sounds are clear, anterior, posteriorly, and bilaterally, and her bilateral chest excursion and her AP is less than her posterior diameter as well, so there's no obvious injuries that I felt. I've also palpated while it was down there as well. I don't feel any crepitus, acute emphysema, no open wounds or second chest wounds, nothing for me to seal or stabilize at this point. So her breathing portion is stable. I'm going to continue on to circulation. So she appears of goodwill color. Her skin is warm and dry. There's no discoloration, no cyanosis noted, no diaphoresis that I see. So, and then I would also notate the cap refills. Cap refills are good, pulses, radial, and then brachial, and then posterior and pedal pulses as well, and their cap refills on her toes. So cap refills are less than 2 to 3 seconds, and the skin was warm and dry, and good color notated here. In addition, I could just also see it all in the back. Would you lean forward for me so I don't feel anything here? Nothing in the back, no obvious bleeding, and nothing behind her kneecaps there as well. So I'm going to continue on to the history taking portion, where I would ask and obtain her history. I would investigate the chief complaint, the history of present illness, what she presents today, and using the OPQRST method. So Miss Mary, can you tell me about this chest pain? When did it start?
It started approximately 30 minutes ago when I was sitting down watching TV in my living room.
Okay, and you weren't exercising prior to? It just started out of nowhere?
It just started out of nowhere.
Okay, can you tell me about the quality of this chest pain? What does it feel like? Can you describe it?
It feels like somebody's just squeezing my chest.
Something squeezing, okay. Does it radiate anywhere? Does it stay in the same place?
It goes down my left arm.
Down your left arm, okay. And then can you tell me on a pain scale 0 to 10, 10 being the worst pain you've ever felt, how would you rate the pain scale right at this time?
A 5.
And you said the timing, it started about last night? Just 30 minutes
30
ago?
minutes ago.
And you've never felt this pain before?
No.
No, okay. And then I will also obtain her medical history using the sample method. I would ask any additional symptoms and address any pertinent negatives. I would ask about, and do you have any allergies to any medications or any shrimp, shellfish, or iodine?
No.
Not that you know of. Do you have any past medical history?
I do not.
No? Okay. And when was the last time you ate something?
Last night.
Okay. And then was there anything significant about the recent events today or yesterday that could possibly, no? Okay.
No.
All right. Medical history is obtained. At this time, she is stable, so I could continue on to my secondary assessment. So I would systematically assess her from head to toe. This is a little bit more in depth than the primary, where I could spend a little bit more time getting more focus on the complaints. So I would assess her pupils again, just kind of look and see. There's no drainage or bleeding anywhere that I see. There's no deformity, so I would address again the decap, DTLS, any deformities, contusions, abrasions, any punctures, burns, or tenderness, literally from head to toe. So I assess the head, there's nothing there. Can you give me a good smile? Perfect, no drainage behind the ears, no bruising, no battle sign, no bloody nose, and I would also just kind of take a look inside her nose if I haven't done so already. I'm just gonna bring it down, perfect, and smile again, say ah, perfect, okay. So there's no airway obstruction again. I look down into the neck, no deformities, no unusualness. So I've already exposed her a little bit, but for this portion, I'm gonna go ahead to literally expose her. So I'm gonna go ahead and undress you, if I have your permission to do so. I'm just gonna expose it just a little bit, just so I can see, and expose her chest and expose her belly to see if there's any obvious injuries. At this time that there's not. Okay, so and I've listened to the lung sounds. I can listen to the heart and assess the belly. I would inspect it, and I'm going to palpate, and there's no rigid abdomen. It's soft, no tenderness noted. Everything looks okay, and I will assess also her pelvis if need be. Pelvis is stable at this time, and I would assess her extremities and pulses. I've already assessed extremities, good range of motion. She was ambulatory on scene, so there's nothing abnormal with that. In addition, I would take some vital signs. So I'm gonna go ahead and take some vital signs on you and put the scan back up.
Thank you.
You're welcome. So I would utilize a manual blood pressure cuff using my stethoscope and against the brachial artery. But at this time I have an automatic, so I'm going to go ahead and continue that, I'll get her pulse oximetry. If I feel it's necessary, I can also get an end tidal. And at this point, also a blood glucose level. Okay, and I can also get a temperature. Alright, underneath the tongue for a minute. Thank you, Miss Mary. .8, and while she was resting, I counted respirations of 18 regular, spontaneous, unlabored, and we'll wait for the vital signs to continue on. So during this time, I would continue to reassess for any potentially unstable. She is stable at this point, but there is a possibility for potentially unstable throughout because of the chest pain and the nature of she's never experienced this before, so this is something that we would consider. So vitals are stable, oxygenation is good, 99%, heart rate of 85, and I will also kind of compare that as well. And if it was irregular, I would count the whole full minute, and blood pressure is stable as well. So with this said, do you mind if I have your permission to, or can transport you to a chest pain center or a hospital to get you evaluated for your chest pain?
That's fine.
Okay, so we have a permission to proceed, and we'll go ahead and load transport and take her away. And during transport, if there's any change, I would continue to reassess her status and repeat any primary assessments if needed.